Today we're going to talk about stress fractures with runners, and particularly we're going to talk about tibial stress fractures. This is a very painful condition, but if you don't treat it the right way, it could bother you and actually cause you to have to stop running altogether. So this is a picture here that depicts a tibial stress fracture, and again, this is very similar to shin splints. So shin splints, again, you have pain down the medial border of your tibia. It's really hard, almost impossible to figure this out without what we call a bone scan. A bone scan measures your bone and shows if you have any increased circulation or increased cellular activity at the area where you have bony inflammation. So if you have a positive bone scan, and a lot of times this happens when people are increasing their mileage as they train for a marathon, all of a sudden they get this tremendous pain, and as a result of that repetitive loading of the bone, it just can't handle it. So the treatment for this is actually to put you in a boot and put you non-weight bearing on crutches for anywhere from 2 to 4 to 6 weeks, depending on how your symptoms resolve. Once you come out of that boot, and do the non-weight bearing conditioning, usually you return back to activity pretty quickly. We have to restore calf flexibility and make sure that we restore strength that comes from disuse from the non-weight bearing condition. But if you don't recognize a stress fracture and you continue to weight bear on it, you'll never get well. But non-weight bearing and being very compliant with your non-weight bearing activity is very important in treating a stress fracture.